Tonight, Robin Gill.
Good evening and thank you for joining us. Lots to get to tonight as we track the spread of COVID-19 in Canada. But we want to begin with another public health crisis that's a consequence of the virus. Across the country, reports of anxiety, depression, and mental health issues are growing. And there's concern not enough is being done to help people who are struggling. This month, the Canadian Mental Health Association surveyed more than 1,500 people. Of those, only 35% say the current public mental health system is meeting the needs of Canadians. Many provinces and the federal government have committed millions to help tackle the issue. But an Ontario man says he was turned away. Our Abigail Bimman has his story.
I was having some pretty dark thoughts. I was having trouble getting out of bed in the morning.
Facing extra pandemic stress, Elliot Hudson knew the warning signs and knew when to ask for help.
And then I discovered Beacon.
His therapist suggested MindBeacon. The Ontario government has provided it nearly $2 million to offer free virtual therapy during COVID-19. But after completing an intense application he says took him 90 minutes, Hudson was turned away.
Beacon is not equipped to support the challenges of substance abuse, suicide attempts, and more immediate and critical needs of clients.
While Hudson has a complicated history, he wasn't in crisis when he reached out.
It was extremely cold, impersonal, and discouraging, to get an email back from a so-called mental health organization that says, your problems are more than we can handle.
That piece hurts because, of course, mental illness is a lot about feeling separate in the world. And that is certainly, an invitation to feel separate.
Shocked to hear the reply, Hudson's therapist reached out to other clients telling them not to apply, worried about the intense application and form letter rejection.
For some of them, it could actually have been, fatal.
MindBeacon refused multiple interview requests for this story. In emailed statements, the company says it is not a crisis service and points out that message is on the bottom of its website. MindBeacon said anyone who's experiencing issues outside, quote, listed capabilities is supported in accessing more appropriate care in their area.
Well, this is the first I've heard about it, but what I can do is promise the people that are having challenges right now. I'll talk to the Minister of Health. I'll follow up with the organization that you've said, and we'll be on it because we are a government that's putting more money into mental health than any time in the past.
A promise from Ontario's Premier, while new data from the Canadian Mental Health Association shows the need is critical.
For many people, the situation has gotten worse. People are feeling more worry, more anxiety, and more stress as the pandemic goes on.
Therapists like Hudson's brace for a tough winter. She's had more calls outside work hours in the last few weeks than the last 5 years combined. Abigail Bimman, Global News, Ottawa.